As we age, our bodies undergo various changes that can make us more susceptible to certain health issues. While it's impossible to completely avoid health risks, there are several steps we can take to mitigate them and promote healthy aging. So if you're a senior citizen or care about the well-being of an elderly person, then this is the video for you. Make sure to watch till the end because each point mentioned in this video is crucial. Also, please take some notes. The risk of cancer increases with age due to several factors, including genetic changes that occur over time, a weakened immune system, and exposure to carcinogens. A stroke occurs when the blood flow to a part of the brain is interrupted, depriving the brain cells of oxygen and nutrients, and can cause permanent damage. Several factors can increase the risk of stroke, such as high blood pressure, high cholesterol levels, and diabetes. This condition occurs when the body loses too much bone mass or doesn't make enough bone tissue, leading to a decrease in bone density and an increase in the risk of fractures. Several factors can increase the risk of osteoporosis, such as a lack of calcium and vitamin D in the diet, a sedentary lifestyle, and a family history of osteoporosis. This decline can manifest in various forms, such as memory loss, difficulty concentrating, confusion, and impaired judgment. While some level of cognitive decline is normal with aging, more significant declines can indicate serious conditions like dementia and Alzheimer's disease. Several factors can contribute to cognitive decline, including a lack of mental stimulation, social isolation, poor diet, and underlying health conditions. However, there are several things that seniors can do to help maintain their cognitive health and reduce the risk of cognitive decline. Engaging in mentally stimulating activities such as puzzles, reading, and social interaction can help keep the mind sharp and reduce the risk of cognitive decline. Maintaining a healthy diet and getting regular exercise can also help improve blood flow to the brain and reduce the risk of cognitive decline. Additionally, seniors should also be aware of the signs of cognitive decline and seek medical attention if necessary. By taking these precautions, seniors can help maintain their cognitive health and reduce the risk of serious cognitive impairments as they age. As people age, their risk of osteoporosis increases due to hormonal changes such as a decrease in estrogen levels in women after menopause. If you enjoyed the video, please leave a comment below and let us know what other topics you would like us to cover in future videos. Don't forget to like and share this video with your friends and family so that they can benefit from it too. And most importantly, stay healthy and take care of yourself, which can lead to a loss of bone mass and an increase in the risk of fractures. However, there are several things that seniors can do to reduce their risk of osteoporosis. Getting regular exercise, such as weight-bearing exercises like walking and weight training, can help maintain bone density and reduce the risk of fractures. Eating a balanced diet that is rich in calcium and vitamin D and low in sodium can also help maintain strong bones and reduce the risk of osteoporosis. Additionally, seniors should also be aware of the risk factors for osteoporosis and take steps to address them, such as getting regular bone density tests and taking medications as prescribed by their doctor. By taking these precautions, seniors can help maintain their bone health and reduce their risk of fractures as they age. These conditions can damage the arteries and lead to blockages that can cause a stroke. Falls are a leading cause of injury and death in seniors, accounting for 30% of all injury-related deaths in adults over the age of 65. As people age, their risk of falling increases due to factors such as decreased muscle strength, balance problems, and vision problems. Falls can result in serious injuries such as fractures, head injuries, and soft tissue injuries, which can be life-threatening or require long-term care. However, there are several things that seniors can do to reduce their risk of falls. Getting regular exercise and maintaining a healthy diet can help maintain muscle strength and balance, reducing the risk of falls. Making modifications to the home environment, such as removing tripping hazards and installing grab bars in the bathroom, can also help prevent falls. Additionally, seniors should also be aware of the risk factors for falls and take steps to address them, such as wearing supportive shoes and getting regular eye exams to maintain good vision. By taking these precautions, seniors can help reduce their risk of falls and maintain their independence as they age. Seniors are at increased risk of stroke due to age-related factors, such as a decline in immune function and a higher likelihood of having other risk factors such as heart disease. However, There are several things that seniors can do to reduce their risk of stroke. Following a healthy diet, getting regular exercise, and avoiding tobacco smoke and excessive alcohol consumption can all help maintain healthy blood pressure and cholesterol levels, reducing the risk of stroke. Additionally, seniors should also be aware of the signs of a stroke, which include sudden weakness, dizziness, difficulty speaking, and vision problems. By recognizing the signs of a stroke and seeking medical attention promptly, seniors can minimize the damage caused by a stroke and improve their chances of recovery. As we age, our cells begin to deteriorate, and this deterioration can lead to changes in our DNA, which can then lead to the development of cancer. Type 2 diabetes is the most common form of diabetes, and it occurs when the body becomes resistant to insulin, which is a hormone that regulates blood sugar levels. Several factors can increase the risk of developing type 2 diabetes, such as obesity, physical inactivity, and a family history of diabetes. As people age, their risk of developing type 2 diabetes increases due to factors such as decreased muscle mass, hormonal changes, and a less active lifestyle. However, there are several things that seniors can do to reduce their risk of developing type 2 diabetes. Maintaining a healthy diet, getting regular exercise, and keeping a healthy weight can all help improve insulin sensitivity and reduce the risk of type 2 diabetes. Additionally, seniors should also be aware of the symptoms of type 2 diabetes, which include frequent urination, excessive thirst, and blurred vision. By managing their blood sugar levels effectively, seniors can reduce their risk of developing complications related to diabetes, such as heart disease, stroke, and cognitive decline. Our immune system plays an important role in protecting us against cancer by identifying and eliminating abnormal cells before they become cancerous. However, our immune system weakens as we age, making us more vulnerable to this disease. Exposure to carcinogens such as tobacco, smoke, radiation, and certain chemicals can also increase our risk of developing cancer. While there is no guaranteed way to prevent cancer, there are steps that seniors can take to reduce their risk. Eating a healthy diet rich in fruits, vegetables, and whole grains can help protect against certain types of cancer. Regular exercise can also help maintain a healthy weight and boost the immune system, making it more effective at fighting cancer cells. Avoiding tobacco smoke and limiting alcohol consumption can also help reduce the risk of developing cancer. Without further ado, let's get started. In this light, today's video will discuss some of the top health risks for seniors and how to prevent them. 1. Heart disease. Heart disease is the leading cause of death among seniors, accounting for 32% of all deaths in adults over the age of 65. This is mainly due to the fact that as people age, their risk factors for heart disease increase. For example, high blood pressure and high cholesterol levels are common in older adults, and these conditions can damage the arteries and lead to heart disease. Additionally, seniors may also be more likely to have diabetes or a history of smoking, which can also contribute to heart disease. However, there are several things that seniors can do to reduce their risk of heart disease. Eating a healthy diet rich in fruits, vegetables, and whole grains, while limiting saturated and trans fats, can help maintain healthy blood pressure and cholesterol levels. Regular exercise, such as brisk walking for 30 minutes most days of the week, can also help keep the heart and arteries in good condition. Seniors should also avoid smoking and limit alcohol consumption, as these habits can exacerbate existing heart problems. By following these tips, seniors can significantly reduce their risk of heart disease and live longer, healthier lives. 2. Cancer. Cancer is another leading cause of death in seniors, accounting for 22% of all deaths in adults over the age of 65. 3. Stroke. 4. Diabetes. Diabetes is a chronic condition that affects the body's ability to regulate blood sugar levels, which can lead to a number of health complications. 5. Osteoporosis. Osteoporosis is a condition that causes the bones to become weak and brittle, making them more prone to fractures. 6. Falls. 7. Cognitive decline. Cognitive decline is a common concern for many seniors, as it can affect their ability to function independently and enjoy their later years. Thank you for watching. We hope that this video was informative and helpful for you.